Welcome to CDH Australia's webcast on how the drug Vasopressin can help babies with CDH. Today we're speaking with Associate Professor Arvind Sehgal, Staff Neonatologist at Monash Children's Hospital, who is going to explain to us how Vasopressin works. Professor Sehgal recently used the drug on CDH Charlie with success. Welcome Arvind, and thank you for speaking to us today.
Thank you, Margaret, and I'm glad to be of help to families and also to medical nursing staff who care for infants with CDH. So look, my background is that I joined Monash Medical Center about 9 years back. I finished my fellowship in neonatal perinatal medicine in Toronto, the hospital for sick children, and prior to that I was a cardiology fellow in University College Hospital in London, UK. So working in Toronto obviously gave me a lot of experience and exposure to critically sick babies, including babies with diaphragmatic hernias, and at that time I developed close links with physicians and researchers based in North America, and that's where most of the new therapies and advances in critical care tend to originate.
Great. And can you give us a bit of background as to the experience at the Monash Children's Hospital with CDH patients?
So look, in Victoria there are two places where diaphragmatic hernia babies are operated. One is the Royal Children's Hospital and the other is Monash Medical Center, which is going to become a Monash Children's Hospital very soon, early next year. And we admit about 8 to 10 babies a year, and obviously each baby is different. We are in a unique position because we have facilities for antenatal diagnosis, so parents see the antenatal ultrasound people, they see the surgeons, and we come and talk to the parents before the baby is born, so we have a good relationship with the families before the child is delivered.
Yeah.
And once the children are born, we monitor them very closely and they get operated, and the family stays close by. So it's like a one-stop shop for most babies with diaphragmatic hernias. And there is obviously once in a while a case which is very severe who might need a therapy called ECMO, and that's available only at the Royal Children's Hospital. But otherwise, for full management, we are well equipped.
Great. And from once the baby is born, what are the greatest challenges that CDH babies face medically?
Yeah, I think obviously a small baby going towards surgery is a challenge in itself, but from the medical point of view, there are 2 or 3 things which we really keep a close eye on. One is because these babies are really living on one lung, which is well formed, and if the diaphragmatic hernia is on the left side, which is commonly the case, then that side lung is really small and not well grown, and technically it's called hypoplastic lung. And obviously the lungs not formed and the blood vessels in the lungs are also not very well formed, so there's not much oxygen going through that lung and also not much blood going through that lung. And even the blood vessels which are formed, they are quite thick-walled, so it's not normal makeup in any case. So this sets the stage for once the baby is born, that sometimes we struggle to get oxygen through the baby's lungs into the baby's body. So oxygenation can be an issue. And in some cases, there is an added element of high pressure in the lungs. So it's called pulmonary hypertension. So the pressure of the blood in the lungs is quite high. So those are 2 major things we deal with. And the third thing which sometimes can complicate is that the blood pressure in the rest of the body is quite low. So it's high in the lungs and it's low in the rest of the body. So our attempts at stabilizing a child in the first 2-3 days are really focused on these aspects, that as much as we can get good amount of oxygen through, keep the pressures in the lungs low, and keep the pressure in the rest of the body normal or high normal. And obviously this leads to a stage when the child is ready for surgery.
Yes. And the use of Vasopressin, can you just explain to us what the drug is regularly used for and what effects it has for the body?
So look, vasopressin is a hormone which is produced in the body, in the kidneys, and its main role is to control the amount of fluid in the body. So for example, if you end up drinking 3 liters of water, then the body will produce less of vasopressin, so all the extra fluid you've taken in, you would pee it out. On the other hand, if you ended up in a situation where for 2 days you don't have access to water, then the body wants to conserve whatever water you have inside. So the kidneys will release a lot of vasopressin, which will help conserve the water and you would pee less. So that's the main role. And it's released in the body in a very low concentration. And in those concentrations, it doesn't really have effect on the rest of the body. So it's a very selective hormone which really works on the kidneys, and its role is to maintain the normal fluid balance in the human body.
And how did the drug help Charlie in her treatment?
So look, different forms of this drug have been used in children with not diaphragmatic hernia. They have occasionally been used in 1 or 2 cases in the American population where the pulmonary pressures have been high. It has been used in a series of cases in the US, about 13 cases. But other than that, the experience with this particular drug for CDH is very, very limited.
Yes.
And the way this medicine works is, as I said, the pressures in the lungs are high, and this drug would gradually reduce those pressures, and the blood pressure in the rest of the body is quite low. So this medicine increases that pressure. So it's a paradoxical effect. In the lungs, it reduces the pressure, rest of the body, it increases the pressure, which is what you want in babies with CDH. But it's important to understand, as I said earlier, that the lung, especially on the left side, is not formed very well. And because the lung's not formed very well, the number of blood vessels in that lung are also very less. And whatever vessels are there, they're very thick-walled.
Yes.
So it's not a normal anatomy we are talking about. So the vasopressin would need blood vessels for it to act. If the blood vessels in the lungs itself are very less, then it doesn't really have the place on which the medicine can act. So although for this particular baby, it was very helpful in increasing the baby's blood pressure, and also it reduced the baby's pressure in the lungs nicely. But as I said, the overall experience around the world with this drug for this particular illness is not widespread. It's
Yes.
very few babies and very few places. So we're not proposing this should be become a routine use at all. It has to be studied in more babies in a proper systematic fashion for people to be more confident and comfortable that yes, this is something which is very useful.
Yes. So at the moment, is the drug more used as a way of avoiding the use of ECMO, or like at what time would you consider using vasopressin?
Look, I based my comments on the series of 13 cases in the US, and in those babies it was used. So all those babies were heading towards ECMO.
Mm-hmm.
So it was it improved the situation so much in about 6 of them that ECMO was no longer needed. And this is the situation in which we also used this drug. But as I said, these are a handful of cases, and if you compare with the number of cases of CDH around the world, the experience is really less.
Yes.
But if it has to be used, then till now, that's where it is used, as babies are heading towards ECMO. It's not used very early on.
Okay. And what sort of benefits, if the drug is successful in avoiding ECMO, what are the benefits gained in comparison to going on ECMO?
So look, ECMO obviously is a highly invasive procedure where the blood vessels in the neck are accessed and some cannulas and catheters are put. So basically it's a way of dialysis. So take away the blood which has less oxygen and from outside put new blood which has more oxygen. So it is very invasive. Second is obviously it's not available everywhere. So as I said, in Melbourne it's available only at RCH. And so travel or transport of a baby who's already critically ill becomes a major issue. Third important thing is to understand that it depends on the baby's size also. So babies who are born less than 34 weeks or very small, less than 2 kilo babies, their blood vessels in the neck may not be big enough to actually be accessed anyway.
Yes.
So there are logistic reasons, and obviously if, again I say, this drug needs to be studied in more detail on more babies before we are absolutely confident. But if there is an intervention which can improve the baby's oxygen levels, bring the pressure in the lungs down, and increase the pressure in the rest of the body, and prevent the babies going towards ECMO, then it would be a major contribution in the care of CDH babies.
Yes, for sure. And is the drug used in conjunction with any other drugs?
So as I said, it's not a first line to be used. Most people would have tried 2 or 3 other medicines for various reasons before this comes into play.
Yes.
But it's not in widespread use anyway. So most people use 1 or 2 other medicines to pop up the blood pressure in the rest of the body. And they sometimes give nitric oxide, which is a gas, through the ventilator to reduce the pressure in the lungs. And so those are stock standard therapies and which are really supportive. And in the series of cases in the US, Vasopressin came after those things had been tried. So it's not a first line therapy.
Yes. And with the limited amount of sort of patients that are being treated this way, is there any research going on to collect the data or publish any research papers that can sort of spread the word, I guess?
Yeah, so look, our own experience, we have written it up and it's being reviewed by a surgical journal. So it's a bit of description of the baby's illness and, when we started the drug and how it showed that baby's situation improved, and a bit of recommendations from our side. So that paper is under review currently, and hopefully in the next few months something should be published. And these are important surgical journals, so surgeons read them.
Yes.
And also doctors who are taking care of babies with CDH, but not surgeons themselves, they also read that. And so that is the way to spread the word in the scientific community.
Yes.
So more people come to know that there is an option available.
Yes.
Although the limited number of babies in whom it has been used, this is something which should be looked at, in more detail.
Yes, definitely. Well, we're very glad that we sort of stumbled upon you through the article that was written in the newspaper on Charlie and your involvement in that. So that's another benefit, is that it sort of got CDH Australia in touch with you, and we're very grateful for your time today to talk about this, and I'm sure it'll probably raise some questions. So if it has raised any questions for any of our listeners, please feel free to email us those questions at information@cdh.org.au, and we will follow those questions up with Dr. Sehgal, if that's okay. And thank you for your time today, Arvind. We really appreciate it, and we look forward to being in touch with you.
Most welcome, Margaret. I'm just looking at the list of questions which I was given. There is, so in our case,
yes,
when the drug was started, I was looking at the original paper from the US also. It started to show results in in the first 6 hours itself. But I make the point that this is not the fix for the baby. This is something which we want to use to stabilize the baby so he or she can have surgery.
That's right.
It's not a replacement for surgery, obviously.
No.
And while other drugs have been studied and in more number of babies, this is something which is relatively new for this particular diagnosis. It's been used for a lot of other indications. For example, if a child has had heart surgery and the blood pressure is low, Vasopressin is in routine use. For simply low blood pressure, Vasopressin has been used in the US for about a decade.
Yes.
For this particular diagnosis of CDH, where blood pressure might be low and the pressure in the lungs might be high, for this particular diagnosis, it's a recent introduction. And if it's studied in more detail and in larger number of babies shown to be efficacious, then hopefully someday this would become a regular part of our therapy for these infants.
Yes, thank you for that clarification. Yes, we are always very hopeful that anything that can help the survivability of CDH babies is, our ultimate goal. It's a condition that's very cruel and has significant impacts on families. So we are very pleased when we hear of advances in drugs and treatments. So thank you for sharing with us today.